I've been in this region of Karamoja for quite a number of years. Actually, when I came, it was last century. I was here already in the 80s as a young doctor. I've been working in this area since that time with the government. Then I've been working just as an advisor for the districts and the hospital. And right now my work is the one of health advisor for Moroto Diocese. And during this year, I learned a lot from the community here. Actually, right now I'm still learning. I'm still learning a lot. So I really welcome this initiative of the Ministry of Health to have this strategy of the community involvement in the health program. It is essential. No health program will succeed unless the community is fully involved. That was probably one of the mistakes we did in the past. And that is why Karamoja is still behind. Karamoja has been left behind for many years, since the colonial time. That is why we have less hospitals, less roads, less schools and so on. So it's time now for Karamoja to develop. Karamoja community is a unique community in Uganda. Let the community be involved. See, Karamoja community is the poorest in Uganda, but that does not mean that we have to associate the fact that it's poor to the fact that it's backwards. What I learned is that they are not backwards. They have a lot of resources. We just need to identify those resources and value them. Because what I learned is that if the community is fully involved and is really the one managing the health services, that is when you will have success. With a lot of development have taken place, the situation has definitely improved. Look, for example, at the maternal mortality. Maternal mortality still in Uganda, the one of Karamoja, is the worst, but it has improved. In the 2006, when the census was done, it was about 750 mothers dying over 100,000 live births. Now, the last census showed that it has reduced to about 500. So from 750 to 500. The rest of Uganda has improved from 500 to 326, you see? But still in Karamoja, 500 mothers who dies every year, over 100,000 children, is the situation right now in Karamoja. Is for us unacceptable. Because if you look at the maternal mortality in Europe or America, it is 5. Here is 500. 100 times more. This is a call for the medical people, for the health people to take care of the mothers. For us, we have started already some years ago to involve the community. All our projects, they start from the community. We don't start from any other point. We want to share with the community first. It's not easy. It takes time. It takes time. It takes a lot of resources. I told you, when you want to meet the people who matter in the villages, sometimes you have to be ready to spend a lot of time to go in hard-to-reach areas, maybe to sacrifice yourself to spend the night in the village and so on. But that is the only way to see the people who really matters. So if you want to have the community involved and the community share with you their view, the only way is to involve them directly, but involving the one who matter. And the one who matter are not only the one appointed by the government. One of the mistakes we realized is that sometimes this informal structure was left aside. So now what is important is to have the formal one, the government structure, together with the other one. Yes. I repeat, the mistake is sometimes you see those people are poor people and so on, you feel they are backward. It's not. I learned a lot talking with these elders and so on. Actually, even in London, they have the solution to most of the problems. Community health definitely is the strategy in places like this. But let us not do the mistake of misunderstanding what is the community in Karamoja. You have to understand that this community is different from the others of other places of Uganda. When you understand this and you take on board the people who really matter, that is when you are going to succeed. Do not forget that from the last level, you have to go to the village itself. To the village itself.
Household.
The household.